I'll open it up to Dr. Clayton here to provide a case overview for the day.
Good morning. Today we're reporting 73 new cases of COVID-19 in South Dakota. This does include 3 new hospitalizations. We have no new deaths to report. We have a total of 48 new individuals who have recovered from COVID-19, and we have 407 new negative tests that have been performed. In total, we have 393 cases of COVID-19. That does include 26 hospitalizations, 6 deaths, and 146 individuals who have recovered from COVID-19. For the community impact map, we have no new updates. I'll go ahead and give a breakdown of the new cases that we have. We have 1 case in Bonham County, 1 in Lake, 4 in Lincoln, 63 in Minnehaha, 1 in Oglala, Lakota, 1 in Turner, and 2 in Yankton. As far as the age range of cases, we have 2 in the 0 to 19-year age range, 14 in the 20 to 29-year age range, 25 in the 30 to 39-year age range, 9 in the 40 to 49-year age range, 14 in the 50 to 59-year age range, 9 in the 60 to 69-year age range. For a breakdown of cases by sex, we have 42 that are male and 31 that are female.
With that, we'll open it up to any questions. First question.
This is Morgan at the Rapid City Journal. Is there more testing being done in Sioux Falls area than West River and the rest of the state?
Hi, this is Kim Malsom-Risden. The process for testing is for individuals to contact their provider. The provider will then evaluate the person's symptoms and potentially rule out other conditions. And that process remains the same as it has been. We do not know the rate of testing in different geographic areas within the state. The negative numbers that we receive are reported on a statewide level. So I can't answer the question about rates of testing in different towns.
Would there be any way to know how many negative tests come back in each county? I think that would help us determine how accurate the numbers are and how adequate our testing is in the state.
Sure, I appreciate that question. We are looking at whether we can start to get that kind of data. Remember, we get most test results come from private, including out-of-state labs, and so their reporting of this negative test information is voluntary for us because that's not required to be reported. But we are actively looking at ways that we can enhance our data collection.
Okay, next question.
Mike Moen, Greater Dakota News Service. What have you been able to observe and how this is affecting rural hospital systems? And are hospital systems in danger of closing at this time due to revenue, especially in rural parts of the state?
This is Kim Malsom-Risden. We are actively working with hospitals across the state, primarily for surge planning. We do expect that there will be some financial relief coming to hospitals through the federal bills that have been passed. We are waiting guidance on that to understand just how much hospitals in South Dakota will receive to help them, financially through the COVID response. So we're not hearing anything about any hospitals being at risk of closure. We're working with them to actively, surge their capacity.
Thanks. Question?
This is Trevor Mitchell with the Argus Leader.
Go ahead, Trevor.
Yeah, I was wondering if private labs I remember a while ago it was private labs were able to test, I believe the number was maybe 600 tests a day. Are those numbers still holding at that level?
Trevor, I don't have more recent information than when we last shared that information, but, you know, today we were seeing 400 new negative tests. So we think that the private labs are keeping up with the demand as far as we are hearing from our providers.
Okay.
And
Go ahead, who was that?
Mike Moen, Greater
This is
Dakota
Steve
News Service again. Oh, go ahead.
This is Stephen Groves from the AP.
Go ahead, Stephen.
Do you have an estimate on the number of people who have contracted COVID-19, but their symptoms are not bad enough to receive testing?
No, we do not have an estimate for that.
The information, and the reason for that is, you know, it's still, and as far as literature goes, you know, we're still in the process of identifying, you know, what the true impact of individuals who might be asymptomatic or very mildly symptomatic in populations, and so it's unknown how much that does play a role. You know, it does play a role in transmission and continued spread within communities, but to actually quantify it is very difficult at this point, given what we know.
Is there any sort of correlation or assumption that you're working off of as far as, you know, if there's this many confirmed cases, that would give an indication as far as how many more are not confirmed?
No, unfortunately, we don't have, again, the literature there is not available to really help inform that sort of an estimate.
Okay, next question.
JP from KOR News Radio in Mitchell. Could you give us an update on the possible spread in Yankton at the Walmart pharmacy?
So, you know, we did put out the announcement yesterday, and the business, the Walmart pharmacy, has been, you know, very cooperative, working with us. We did identify individuals that were close, it's considered close contacts within the business, as well as identified that, you know, we did need to issue the public notice to make sure that we could, because we could not track specifically everyone that may have come into contact with that COVID-19 case in that instance. So, you know, that's the update that we have, that, you know, we have been working very closely with the Walmart pharmacy there, and, you know, are asking individuals who may have visited the pharmacy on those days and times to make sure that they're monitoring their symptoms for COVID-19.
Thank you.
Thank you. Next question.
This is Joseph Markov.
Jackie with South Dakota.
Sorry, I couldn't. Jackie, is
Joseph
that you?
Markov with the Capital Journal. All right.
I'll go
Jackie?
ahead. I'm wondering if you can tell us anything about any hotspots you've identified in the Sioux Falls area.
So, you know, one of the things that we have been working very closely with businesses that have been impacted. You know, we have specifically identified one cluster and are working, you know, with the businesses as well as Sioux Falls Health Department to make sure that, you know, we're identifying people that have symptoms of COVID-19, getting those folks tested and following up. But as far as risk to the public, it is a business that's not open, you know, to individuals, and so you know, we're working with that specific business.
Okay. Was the Capital Journal on the line?
Please. Thank you. Good morning, y'all. I was wondering, so we're in the top 20 for per capita testing. I was wondering if you know what we are in per capita in infection rates. It's jumped a couple of days, and I was wondering what it is, if you guys had that, please.
The latest information that we have comparing to other states is that South Dakota ranks number 47 in number of positive cases.
Is that per capita, or is that just in number, ma'am?
That's per capita.
Thank you, Mayor.
You're welcome.
Next question.
Mike Moen, Greater Dakota News Service. A couple follow-up questions from earlier. Back to the rural part of the state. As we've seen a lot of the focus on larger municipalities in the nation, but there's been reporting of this spreading more to rural areas and rural areas bracing for more of a surge. Do you find that to be the case for South Dakota? Can we see more rural areas being impacted in the coming days?
Yeah, I think we fully expect to see cases, pretty much throughout the state. That's the nature of this disease and what we've seen in other states. I'll look to Josh to weigh in.
Yeah, and I think the one thing that we have seen as it's played out nationally with some of the areas that have higher density of people is that you tend to have it start in some of those areas and kind of work its way out. I would say that what we're seeing kind of play out in New York is a good example of that, where they have a large proportion of their counties being impacted by COVID-19. But the majority and their kind of epicenter for activity is within New York City itself. So I do anticipate that, as we have more cases, that we'll start seeing more of those cases in more rural areas.
And thank you for that. And a quick follow-up to that, getting back to the healthcare system in rural areas, I know that you had said that you don't anticipate there might be some aid, and you don't anticipate any of them closing down. But what about staffing level, resources at these facilities? Are they equipped to handle an anticipated surge in rural healthcare systems?
So that is part of the work that we're doing with hospitals on an individual basis, is to assess what they need for additional staff and what they need for equipment that they might not have to be able to reach their surge capacity. So that is something that we're currently assessing, and we'll continue to work with them individually on so that they can be ready.
Do they have staffing shortages right now, any of them, or equipment shortages that you can tell us about?
I can say that generally that's been probably the number one and number two concerns about bringing on more beds. Is having enough staff and equipment.
Get your homework out, Taylor.
Okay, we'll take one last question for those of you still on the line.
Yeah,
Sure, I
maybe
could
one
respond
more.
Cam?
What areas are you seeing the community level response be more effective than others?
What areas, you're asking what areas of the community or what areas of the state have been more responsive?
Yeah, just what areas is the community level response kind of cutting down the number of positive cases better than maybe others?
I think it's a little bit hard to know, exactly what the impact is with any specific actions that are being taken by communities. It's not that one-size-fits-all approach, and so I think it's important to realize that even as these are taking action, it will take several weeks to kind of see that impact overall. And one of the areas that we are not able to figure out is what happens for actions that are taken. What sort of cases might have been averted by taking those actions. So we deal with what we can track and what we can count. Right now we're not seeing any sort of drastic decreases in cases in certain areas based on activities, but we're hopeful that the activities that have been, the actions that have been taken by mayors and county council and by the governor, really have helped to decrease our overall numbers that we would anticipate if we had not made some of those completed some of those actions.